Thank you very much for the very kind introduction. So I will give a short presentation about a topic that I feel very passionate about, and it has to do with computer tomography, in particular in dogs, and with their teeth. So computer tomography is a very popular diagnostic tool in many countries, and increasingly also in Brazil. One of the advantages of this imaging technique is that you can use it for every body part. So it's very, very versatile, and it is very good for almost any species that you can fit into a CT scanner. There's lots of special applications you can use it for. You can measure different things, you can compare different things, so that is another advantage. And there are very few restrictions of why you couldn't use it. One of them is that there is X-rays emitted, so there's radiation involved, so there's always a safety issue with this. But in general, it's an extremely versatile tool, which I think also why it's a very successful tool and why it's used so much now. Particularly the more modern CT scanners are also very fast, and therefore we can do an examination in between 1 and 2 minutes now. CT is an excellent imaging modality for the dental diseases, and CT is at the moment underused for dental disease, even in places where CT is performed already in lots of clinics. So in Brazil you don't have that many CTs, but in other countries where many, many dogs get a CT, very few of them get a dental CT. And I think that CT could and should be used as a regular screening tool for dental disease. So many clinics in Western Europe and North America, you have 5 to 10 CT cases a day. It's a new standard. Some clinics have even more. And usually the split of what you do with them is with the CT is 25% maybe head, 20% spine, 20% thorax, 20% orthopedics, and 10% abdomen. On abdomen is currently rising, so we're doing more and more abdomens as well. Dental disease is very common in many species that veterinarians treat. In dogs, cats, rabbits, rodents, horses. All of these diseases have frequently dental disease. In dogs, the most commonly seen dental diseases have to do with apical infection, so tooth root infection, or possibly also fractures. And it is for these that CT is in particular useful. Beside the proper dental disease, other oral and masticatory diseases are also relatively common in dogs. And one thing about dental diseases, we all agree that this is not an incidental finding. This is a painful condition. The dental disease can serve as a nidus of infection for other body parts, so it doesn't just affect the dental system but the whole body. And it is also a disease with which you get an understanding of the owner that it should be treated, because people experience dental disease and the pain, and so if it's communicated properly with the owner, the need to treat dental disease can usually effectively communicate it. However, with clinical examination alone, dental disease can be difficult to detect, and this is particularly true in dogs because many of the dental disease in dogs are below the gum line. So there are the roots, you cannot see this. And also a proper oral examination requires general anesthesia. So it's difficult to do in a non-sedated dogs. And the clinical signs in dogs are hidden. They don't eat properly, but they're not clear-cut because they cannot express pain the way humans can. The classical workup for a dental disease is to use intraoral radiography or dental radiography. You need special equipment for this, which most veterinarians will not have. It is very time consuming. You do need general anesthesia. Take good dental radiographs is technically very demanding. And usually you only perform x-rays for teeth of certain teeth, not all teeth of the mouse. Dental CT, however, is part of the head CT that we perform in about 25% of our patients anyway. It is very quick. It takes about 30 seconds. It is technically relatively simple. You always image all the teeth in one examination. And there's a wide range of dental pathology that we can identify on CT. We have developed a protocol for CT of how you should run your CT, what technical settings you should use to optimize it for dental disease. And that protocol also works for other areas of the head, so there is no extra CT involved. And this is from this study where you can see that the definition of the tooth is better than with other settings. So, there we go. So here now is just some examples of what you can see on dental CT. So we can diagnose root fractures and root remnants of fractures. Here we can see tooth root infections around all three roots of this tooth, and also a carious lesion. This is an abscess that has got into the pulp cavity of the tooth, so it's a pulpitis. And you can see gas in the pulp cavity, something you cannot see on radiographs. And you also see the abscess that is draining from it into the oral cavity. Okay. This is an example of a dentigerous cyst. There are different types of cysts associated with the dental system. Some are very common in dogs, particularly in brachycephalic dogs, which are more and more popular. And here you can see one of those cyst formations forming. And you probably know that cats have so-called odontoclastic lesions or resorptive lesions. Dogs have them as well. And this is just an example from a CT scan where you can see the resorption, particularly of the canine tooth, but also of the premolars of the root. So it's very well visible on CT. Okay. And even diseases like periodontal disease are visible on CT. You can see the irregular bone surrounding these teeth, the fracture here as well. So it's also recognizable with CT. And now we come to some neoplastic conditions associated with the dental system. So here we got an epulous formation, which is an acanthomonas ameloblastoma. So you can see the destruction of the tooth, of the bone surrounding the tooth. And here's a more subtle one where you get separation of the bone from the tooth and there's a soft tissue lesion associated with it. Another example is here a malignant melanoma arising around the tooth root, and you see there's contrast enhancing mass with it. Malignant melanomas have a high tendency for metastasis, and so one of the advantages of CT is that you then can image other body parts which are likely affected by metastatic disease. So here you can see metastatic lesions in the liver and also here in the kidney. So this will change your prognosis and your treatment options for it. So, and all this can be done in one examination of the dog. We also perform CT in sedated animals only, for which we have these special containers, plexiglass containers, called the mouse trap, but it's not for mice, it's for cats and small dogs. So they are either not completely conscious or just a little bit sedated. For cats, it works well for the thorax and abdomen, but not so much for the head because they move their head too much. But in rabbits, it works really well to look at their dental system. So here's an example of how the CT looks like. In the box, that's the rabbit, and I will magnify the image. And this is the image quality that you get. So the projection isn't ideal, but you can see the teeth really well with it. So it's an easy way to do a dental imaging examination in a rabbit, which gives you much more information. There's another example here of a cat. Here's the mandible of a cat with a squamous cell carcinoma. And we also have a CT that is usable for dogs and cats and horses. So the horses enter the CT from the other side, so if that is something for a practice that treats both small and large animals, that's another advantage of CT, that you can perform a CT for a horse with the same equipment. And this is kind of the image quality that you get. So we perform 1 or 2 CTs for horses a week, and we almost never perform dental radiographs on horses anymore. Everybody gets a CT because you can see everything. And again, it's a very quick examination. If the horse behaves well, we're done in 10 minutes. So. Once we have generated our CT images, we can also reconstruct them in a way that are better understandable for the veterinarian that treats the dental disease. And one of them is called curvilinear reconstruction, which is similar to what you may have seen as a panorama radiograph of the teeth. So you're just stretching the image along the axis of the teeth. So, and that looks like this. This is a curvilinear reconstruction of a CT in the rabbit. And you can see the dental abscesses here, periodontal abscesses, and the relationship of these teeth to it. So it's a very useful way. Same thing here in the horse. So you can see all the teeth lined up with each other and can investigate them individually using this easily accessible technology. Now, I work at the Royal Dick School of Veterinary Studies at the University of Edinburgh. We are a referral center, so we have lots of specialists, but we don't actually have a dentistry specialist at the moment. And so the CTs that we perform are not performed to work up dental disease because we don't have any dental specialist. But despite that, we did a little statistic, and in 2014 we CT'd 147 dogs And of them, 18% had a dental or an apical infection. Another 13% had odontogenic cysts or resorptive lesions, and 14% had oral neoplasia. So about 30% of these dogs were basically had evidence of dental disease that were not anticipated. They were randomly picked up. And this just shows you how frequent dental disease is. And that's why I think it is underused for dental disease. One of the reasons is that the people who do specialize in dental disease, they don't know much about CT. And so they don't ask for it. And also, for people who run a business, a clinic, need to run CTs and other imaging modalities in an economical way, they don't understand yet the frequency of dental disease and how useful CT is. Because basically, a dog comes in with some problem of his head, you do a CT scan, 1/3 of them will have some dental disease that also can be treated. So that is revenue for the practice. It is a good thing to do for the patient. And because owners are understandable about dental disease, they are likely to be willing to have that treated. And this, I think, is where this is a win-win situation, because it's beneficial for the veterinary practice, it's beneficial for the patient, its owner, and everybody. You create a good communication between them. But to make that happen, what you need to do is you need to change the workflow slightly. Because I think the best way to use CT is to use it as a screening tool, because dental disease is so common. So if I were in charge, every dog would have a head CT. So, and again, because you also get additional benefit. And I do think passionately that dental disease is common in dog and it shouldn't be ignored. It's a real disease and it's worth to be treated. So thank you very much. This is my own dog at work chewing. So.